What drew me to plastic surgery, I initially wanted to be a neurosurgeon. I worked with the neurosurgery team on a combined case. The neurosurgery team did their part and the plastic surgery team did their part. And the plastic surgery, the artfulness, the carefulness, thinking about the whole patient really resonated with me, and it made me want to be a plastic surgeon. I would describe my philosophy of care as almost walking with someone down a path or a journey. One step at a time, I'm there for the patient. I'm excited to take each small step with the patient. A lot like taking off an airplane, I'm there for pre-boarding, takeoff, the flight, and landing too. One of the latest and greatest things kind of in the field of plastic surgery that I enjoy is microsurgery. That's where we take a piece of your body from one region that you can expend it, and we keep the blood vessel supplying that small piece of tissue and we bring it somewhere else where you need soft tissue. And then we sew the small blood vessels together such that we bring blood supply into the region. And that's a good way to reconstruct wounds that are very complex and won't heal by standard methods. I'm excited to bring that to the Riverside community.